you know this very well. 74% of Americans are overweight or obese. 50% now of American adults have type 2 diabetes or prediabetes. These were diseases where there was 1% of Americans in 1950 had type 2 diabetes. Now it's 50% of Americans have prediabetes or type 2 diabetes. Alzheimer's dementia are going through the roof. Young adult dementias have increased like 3 times since 2012. So early onset dementias, we're seeing, this 1 in 2 Americans are expected to have cancer in their lifetime now, 1 in 2, and young adult cancers are going up 79% in the last 10 years. We've got, of course, the autism rates are absolutely astronomical. 1 in 36 children has autism now in the United States. That was 1 in 150 in the year 2000. And in California, where I live, it's 1 in 22 with a lifetime neurodevelopmental disorder. We've got infertility going up 1% per year. 25% of men now under 40 have erectile dysfunction. A quarter of the country. This is fundamentally a metabolic disease. We've got 77% of young Americans can't serve in the military because of obesity or drug abuse. We've got autoimmune diseases. Some studies are saying they're going up 13% per year. It's really unbelievable. And I could go through so many more diseases. Of course, we've got heart disease, which is almost totally preventable as the leading cause of death in the United States, killing around 800,000 people per year. And I think as I kind of just looked around, and again, these are just statistics, I started trying to put the pieces together. Why is this happening? Why are these all going up all at once? And that led me on what is now a 7-8 year journey, ultimately leaving the surgical world, putting down my scalpel forever. Because what I realized is that when you go to the science with a root cause perspective, you go back to PubMed with a slightly different perspective, not how do I treat these diseases once they emerge, but why are they happening? You see a very obvious, blaring answer, which is why we had to write a book about it, which is that it's all caused by metabolic dysfunction, a term that I never learned in medical school. I learned about metabolic syndrome and the different individual diseases that make it up. But there is a problem. There is a fundamental breaking of our core cellular biology that is caused by our diet and the world we're living in, the modern world we're living in today, that is crushing the very way that the human body and our human cells can transmit food energy to life energy, to cellular energy. And so our bodies are essentially, fundamentally, because metabolic health is how we make energy in the body, the way that our environment is now synergistic to restoring our metabolic health, and the science is very clear about this, it's basically like all of us are a little bit dead while we're alive. That's what metabolic dysfunction is. It's less energy in the body. We're underpowered. And that's very dark.